Hello, my name is Helen Johnson. Today I'm going to be discussing the documentation process of moderate sedation in the emergency department. You should have already reviewed the YouTube video. You should be familiar with the process as well. You should have the documentation for the procedure in front of you. Okay, so let's discuss the role of the nurse within a moderate sedation. Should be primarily to assess the vital signs of the patient to make sure they're stable, airway, breathing, circulation, and to document this to make sure that the record shows the procedure. The primary nurse should not be participating in the procedure with the physician. If they need a second team member, they should be at the bedside because you cannot be assisting in the procedure and assessing the vital signs as well. So the learning objectives of this assignment are to explain the role of the RN during the moderate sedation process, describe how to set up a room for moderate sedation, identify and list the items needed for moderate sedation, and document a moderate sedation to hospital standards. So, the role of the primary nurse is to monitor, assist in resuscitation, and chart the procedure. You need to chart every 5 minutes on the form, the vital sign assessment. So, before the procedure even begins, let's discuss what we need to do to set up. So the consent should be signed with you and the physician, and all the questions by the patient should already be answered by this time. Now, the pre-sedation assessment needs to be completed. This includes dividing the palate into 4 separate classes. This is what the physician does to ensure that if a resuscitation process was need to be done and he were to intubate, he already knows before the procedure is done. This cannot be done secondary. He needs to do this before the procedure starts, he or she. Also, it also assesses the cardiac disease process of the patient before the procedure starts. And Joint Commission and the nursing board insist that this is a registered nurse's responsibility to ensure this is done before the procedure takes place. So now let's discuss how you need to prepare the patient and the room before the procedure starts. The patient needs to be procedure ready. This means they should be in nothing but a gown. This has nothing to do with having the site available that we're working on, but needs to make sure that if a resuscitation process is to take place, that the body is ready for resuscitation. A patient should have on the telemetry monitor, pulse ox, and the blood pressure cuff. And during this procedure, you need to be assessing this and making sure the patient is stable. An IV line should be in place with a liter of fluids running to make sure the line is patent. And a nasal cannula hooked up should already be to the patient. At the bedside, the patient needs to have a crash cart and an ambu bag, as well as an intubation kit. Also, you need to make sure by now the second team member or third is advised in case you need to do an orthopedic process, and you need to have all the staff ready. Also, you need to make sure all the equipment is working for resuscitation, which includes the suction setup, and you need to make sure that the yonker is hooked up and it works. So now that you're ready and the patient is ready, you need to make sure for the emergency department that you notify your charge nurse and all the rest of your patients have been assigned to another team member. Just make sure all patients in the emergency department are safe. So now all the documentation is at the bedside, and it should be, just to make sure that during the procedure that you have everything there in front of you, including the patient's allergies, when the last time they ate or drank. You need to have all the paperwork for the patient at the bedside. Now, let's discuss the Aldrete score. An Aldrete score is set up specifically for Med-Surg department. It's made for patients out of resuscitation to make sure that you have an adequate transition from the patient for when they were sedated during the procedure and come adequately out of it. It discusses the involuntary movement, breathing, if they're alert and oriented, and their skin assessment, whether it was warm, to their extremities. And every abnormal finding needs to be documented, and this is to protect you and the facility. So this does need to be done, as well as a pre-procedure that discusses the level of consciousness, as well as the cardiopulmonary disease, if they're in a pacemaker, and their skin assessment. The patient could possibly have a disorder that makes it to where they're not getting adequate circulation in their lower extremities, and this needs to be addressed and documented prior to the beginning of the procedure. Now they're ready for the procedure to begin. You need to start documenting every 5 minutes as discussed before. Now, it is important to make sure that you document adequately, and also, when the procedure is complete, is not the end of the nurse's role. The nurse is not to leave the bedside of the patient until the patient is awake and to their baseline and can protect their airway. So that documentation process needs to be continued until the patient is alert and returned to their baseline. And if you did have an adverse event happen, you're not able to leave the room until the airway is maintained and the patient is intubated and you can leave. So that basically discusses the process. If you have any questions on your re-education, please ask, and we'll discuss the procedure. Thank you for your video, and thank you for watching the video, and thank you for your time.